of
Sorry about that.
a number of forums. We've hosted forums on various women veterans issues, available community resources, and best practices in delivering behavioral health services. This past June, our forum topic was connecting communities and preventing veteran suicide. And we share with DVVC a commitment to identifying the gaps in services and increasing veteran services through collaboration. The CVEB of Southern New Jersey is delighted to continue and grow this strong collaborative community with the DVVC, and we look forward to the future. I'm turning the mic back now to Hugo, who will be moderating this meeting.
Great, thank you, Terri. So I'd like to introduce our 4 panelists who have graciously given their time to us today so that we can learn about their responsibilities, their challenges, and how we may best work with them. During the course of this meeting, if you have a question for one of our panelists, please type it into the chat box, which you can access at the bottom of the screen. If your question is for a specific panel member, please put their name with your question. At the end of the roundtable and questions we have given them, we will ask the questions that have been entered in the chat box. If we run out of time and you include your email address with your question, we will send you the answer. We'll be uploading the presentation of the webinar onto our website. As I so rudely did, interrupting Terri, this meeting is now being recorded and we'll put it on our DVVC YouTube channel. And we'll also have links on our social media. So let's get started. So our first panelist is Alicia Kagan, who has been with the Veterans Service Office with the New Jersey Department of Military and Veteran Affairs since 2016. She has always worked with veterans and with seniors and people with disability communities. Previously, she was the Director of Public Benefits at a large South Jersey law firm and also was coordinator at the Camden County ADRC. Our second panelist, Ted Gallagher, Director of Camden County Office of Veterans Affairs, Blackwood and Camden County, New Jersey. He has been in the position of managing the office since October 2018. He assists Camden County veterans with accessing federal, state, and local level veterans benefits, including preparing claims for federal VA benefits, educates the community on veterans benefits, is involved in service medal presentations to veterans, and also involved in veterans ceremonies like Memorial Day, Veterans Day, Pearl Harbor Day, etc. Ted's professional interest is in assisting veterans in obtaining benefits provided at the federal, state, and local level. Such benefits could either be those related to veteran service or health related. He served in the active Army and Army reserves in 78th, 96th, and 98th training divisions from July 1968 to April 1996. That's a good spread. Ted retired from the Army Reserves after 28 years of service in both the active and reserve. While in the Army, he served in Vietnam with Artillery Group Headquarters and Battalion, and in the reserves held various command and staff positions within the training divisions. Our third panelist is Dennis Miller, Director of Veteran Affairs for Montgomery County. He's a retired U.S. Coast Guard commander, disabled veteran, a harmonica and banjo playing fly fisherman, but he's quick to point out that he can't, and I think this needs to be your next challenge. He doesn't do all those things simultaneously. So I think that's the next step. His office has approximately 700 active claims, 4 veteran service officers, 4 shuttle van drivers, and does claims, advocacy, shuttle, collaboration, and he's quick to point out lots of collaboration and serves veterans that need it the most first. Our fourth panelist is Dan Fraley, who works for Bucks County, the 4th largest veteran populated county in PA, with offices in Levittown, Quakertown, and Doylestown. Its primary mission is to assist veterans with claims, pensions, and all state and federal VA benefits. Healthcare benefits are provided by the Michael J. Crescenz VA Medical Center and Coatesville VA Medical Centers, the Victor Saraceni VA community-based outpatient clinic located in Horsham Township, part of the Crescenz VA Medical Center, and the Vet Center in Bristol Township. Washington Crossing National Cemetery is also located in Bucks County. So now I'm going to go into questions, and the panelists know that I will ask them specific questions. But panelists, if you feel like you have something to say or you want to add to a different panelist questions, you're certainly free to do that. One last request: if you're not a panelist, can you shut down your camera so that we can focus on the panelists? So John, Bill, Paul, if you could shut your camera so that we just are focused on the panels themselves. So Alicia, you're first up.
Good morning.
Is there a time limit on filing a VA claim?
No, there's not a time limit on filing a VA claim. And I'm going to kind of condense all the questions into one, because I think that it's important to understand first that there is no time limit for filing a VA claim. There's no time limit for accessing VA benefits. So that's an important piece that I think people need to understand. I think that there are many different reasons why people should file a claim, but I think the bigger question is, why should people reach out to somebody like myself or some of the other panelists? Why do I reach out to a veteran service officer or to a Department of Military and Veterans Affairs? And the reason is because there's so many more services than just that claim. That claim is what a lot of people start to focus on. It's an important piece of the puzzle, but it is just one piece of the puzzle. So there's plenty of people who might think, you know, I'm not going to get a claim. I can't, there's nothing that I had happen to me when I was in the service. Ultimately, that might be true. It may not be true. A lot of times it is not true. You don't know what you don't know until you ask. So I really do like to say to people, there is no time limit, and just ask questions. You don't know. You might not be eligible for that service connected compensation. You may be eligible for a non-service connected pension, either with or without aid and attendance. Being with the New Jersey Department of Military and Veterans Affairs, which is separate than the county, we all do the same thing, but in New Jersey, the county have their service officers, the state has service officers in every county. So there are things like the cemeteries, the state cemeteries, the state memorial homes, the state medals, the tax benefits, property tax and income tax. There's a lot more out there than just the VA claims.
Great. So does anybody else want to add to Alicia? That was awesome. That was very comprehensive. Does anybody want to add to that? Any of our other guests?
Yeah, Dan Fraley here, Bucks County. Yeah, I would just add that surprisingly, people don't realize it, but mental health issues like bipolar, people typically develop bipolar disorder in their mid-20s, and that's usually when you may be in the service. So if you develop bipolar, you can come out of the military and file a claim for that. And so that's one of those things people don't really think about, that it has nothing to do with your military service. But whatever happens from the time you go in to the time you get out as military, bipolar, I know a couple of veterans that have filed for that. They're 100% because of it, because it's a serious disease, mental health issue, I should say.
I think that's a good point that you make. There are a lot of things that people might not, you know, they think, oh, I broke my foot in the military and my foot still hurts. That's an obvious claim. But there are a lot of little things that you as a veteran may not realize, or as the spouse or the caregiver of a veteran may not realize, that could be connected to your time in the service. It may be a roundabout way, but it's certainly worth a conversation. And all of us on this panel do not charge for those questions, do not charge for those answers. So it really is, the worst you could get would be, no, maybe what you started to ask, that's not possible, but here's 27 different things that are possible for you to benefit from with veteran services. I also myself, just because of my background, will also connect people with other state and federal services that may be out there. I spent yesterday doing a food stamp application with somebody because that made a lot of sense for them. So I think it's important for us as veteran service officers to look at the whole picture and address the needs, get to the bottom line of what somebody needs. It may not be VA, it could be partially VA and something else. But I encourage people just to ask, because you never know what you might be eligible for.
No, that's a great point. And I think this is something that we can discuss in kind of the general and I would ask everybody to think about this is, how do you get the word out about what you were just talking about, Alicia? Is how do you I think a lot of people say, hey, I can't get approved for a claim like that. Or they just don't know, and how do we work on spreading that word? So keep that in mind. Any more addition to that commentary to Alicia's questions?
I was going to say something, Hugo. Two
Go ahead.
points.
Yep.
2 points that Alicia came up with. One was the point about reaching out, because one of the things that I think are important is reaching out to the veterans in our community. I'm a county, so therefore reaching out to the veterans in Camden County, but to go ahead and make them aware, educate them of the benefits that they may be eligible for. I distinguish between eligibility and entitlement. Entitlement is you're entitled to go ahead and file a claim with the VA. You may not be eligible for the claim that you file for, but to reach out to tell them, to let them know that there's a benefit out there for those particular veterans. Particularly, I look at Vietnam veterans, because there's probably an awful lot of Vietnam veterans. They're not aware that they served in Vietnam, exposed to Agent Orange, and may have a condition that's presumptive. So that's really, really important. And the other thing, Alicia and I know each other, and we do an awful lot of coordination together. I reach out to her many times. She reaches out to me. We do an awful lot of networking between ourselves. And so I think that's really valuable to know all these people that are on this call, to go ahead and reach out to the right ones to go ahead and get some information. I think that Alicia goes a little beyond me. I don't really do food stamp applications, but that's all right. That's no problem. I can refer somebody to where they should go ahead to get that done. So
that's awesome. So Ted, that's actually a good roll in to you and your question. So very broadly, what is your role in the county?
So what I'm involved with managing the Office of Veterans Affairs. And so what I get involved in is a lot of things that Alicia was just talking about, claims and consultation, which I just mentioned about reaching out to veterans to go ahead and consult with them. But also we get an awful lot of veterans that come into us and they call us up on the telephone and they have questions that they pose to us. From that, it leads to, I can't do anything for you, or I can refer you to someplace that can get the information. Or if it's related to VA, I can go ahead and start the process, when my staff can start the process, or I can start the process of an application for a benefit. We are also involved with flagging. I think everybody knows right around the May timeframe, Memorial Day, an awful lot of flags go up in the cemeteries. Well, a lot of those flags come from the counties. And so they go out to veteran service organizations. They make arrangements to go ahead and flag cemeteries. So we're involved with that. Even my own staff and also staff within the county go out and flag and volunteer to go ahead and put flags down on the graves of those particular people that are buried. Remember, we're talking about that's Memorial Day, which is to memorialize the sacrifices that both people that were in the service, that passed away while they were in the service, or that passed away after they got out of the service because they are veterans. Medal applications, we do all that, presentations, veterans events. So and we also maintain outreach to organizations supporting the veterans. Like we interact with Jefferson Health, Spectre Care, Catholic Charities, VA Health, a whole range of organizations. So that's what my role is within the county.
Cool. And obviously, as you just spoke with Alicia, you coordinate with each other. Do you do things outside the county, and what role do you think networking plays in what you do and how you do it?
I see networking as really very important for how I conduct my job. I reach out to, yes, Alicia, she's with the State Department, the New Jersey Department of Military and Veterans Affairs. I know several other people that work in that particular department, so I reach out to them occasionally. I reach out to a number of other organizations, such as other county, especially in New Jersey, but other county directors or county staff in Burlington County, particularly, sometimes in Gloucester County, also over in Ocean County. I reach out through what they call a New Jersey Association of Veteran Service Officers, which has, it's an organization here within the state that people that are veteran service officers can go ahead and join. And then occasionally we have meetings. Unfortunately, because of the COVID, we have not had those same volume of meetings that we've had in the past. So, I look at county staff to enhance our basically one of the reasons why I reach out is to go ahead and enhance my understanding of the challenges that I face or they face, and how we can and how I can go ahead and influence what they do, or how they can influence what I do. Looking for ways to go ahead and improve the things that we do. Reach out to national organizations such as the National Association of County Veteran Service Officers. As a matter of fact, Monday, Tuesday, and Wednesday of this week, I was in a conference where we were talking about all the things that are happening at the national level. I see that as a particularly really important role more and more. And also, I interact an awful lot with like people like Fern, and also the RO, the VA RO staff over there. So, outside of just the county here, I reach out to an awful lot of other organizations, and also outreach. I'll talk about it in a minute, but there's outreach organizations that we reach out, that we talk to also.
That's awesome. And I think you just mentioned a couple organizations. So the state level of veteran service officers, and then the national. It seems to me that it can be a challenge sometimes to stay aware and abreast of changes in VA benefits and how the VA operates. How do you, and this might be a question that everybody answers, how do you keep track of all that stuff? Is there a formalized process, or how does Ted Gallagher do it?
That's a very good question, Hugo. Yes, there are always changes. I used to work in one time I used to work in the Medicaid program at the federal level, and you can imagine the complexity of that kind of a program. Or you go ahead and take a look at IRS, tax law, tax regulations. Well, the same thing applies in the VA world. And there are changes that are occurring every day. As a matter of fact, on the training that the training at a conference, which part of it was training that I attended on Monday, Tuesday, and Wednesday, we had received a number of presentations from people that are with the VA. For instance, the Secretary of the Department of Veterans Affairs himself, Dennis McDonough, had made a presentation to these particular members of the organization, of which there were 500 people that were on. So there was other presentations by other members of that particular of the federal VA. So it's how do you go ahead and stay on top of things? Well, I think one of the most important ways is basically the networking that I just talked about with Alicia and some of the other people in the other counties, and also working with not only the state veteran service officers, but the county veteran service officers, and especially the federal government. Looking at Fern is a great source of information to me on some of the things that are changing. Also, I got contacts at the Veterans Benefits Administration, the VBA, and they keep me abreast. Another thing that they do is VBA holds both monthly and quarterly meetings, just like this. They get together and we have updates from them. So there's a variety of different places that I go to. And the other greatest thing I would have to say is probably looking at the internet. Last night I was looking at the internet, looking at something just to go ahead and get an update on some things. There's a wealth of information on va.gov.
Yeah, because if it's on the internet, it has to be true, right?
Oh yeah, that's true. That's very true. Yes.
Just a quick anecdote and a lesson learned for me. So I came into this space with a VSO, and my definition of VSO was Veteran Service Organization. And I remember going to Fort Indian Town Gap, I'm in Pennsylvania, and kept talking about VSOs from an organizational perspective. And they were like, what's your definition of VSO? And of course, the other definition of VSO is what you all are, which is Veteran Service Officers. So I would point out to all my colleagues out there that there are two definitions of VSO, and just make sure you understand which one, when you're saying VSO, understand your audience. So thanks, Ted. Did anybody else want to chime in on Ted's answers or questions? Great. So Dennis, you're up next. What do you consider, which category of veterans do you consider most in need, Dennis?
All right, thanks. I want to give you a disclaimer right up front. Number one is there's a lot going on. This is just a piece of it, just a taste. And the other one is that I have a summer cold, so my voice is a little bit broken up. So if you have a question based on what I'm saying, my voice is usually a little bit more clearer. Some would even argue sultry. So just put that out there. Yeah, sultry.
Okay.
But
thanks for that, Dennis.
No problem.
I can't unthink that thought now. So thanks.
Making your day, no problem. But we have to triage our work. We have over 700 active claims, and we're proud to have them and proud to do that work. But we have to triage our work, and the way we triage it is the veterans most in need for us are those with unstable housing, advanced age and crisis, mentally ill, PTSD, which are different, risk of suicide, and those that are either incarcerated or have had contact with the justice system. And by the way, just because this is the electronic age, as I talk, I'm going to be putting stuff on the chat, just so you could look at it. Some people hear better by reading, if that makes sense. But I get a lot of comments on this, like, why do you have risk of suicide so low? It's number 4. And the reason is that we have some tools in our toolbox to help with us, but there are so many other providers out there that we work with and that we refer to. But in unstable housing and advanced age and crisis, I have to tell you, they're kind of linked together. A lot of the homeless veteran problems that we have in Montgomery County are plainly said to be older people who failed to plan financially. And they mix together oftentimes. So that's why they're our top 2. And why are mentally ill and PTSD different? But well, because PTSD, and I have a thing to put up on the. I have another question about PTSD, but bipolar, schizophrenia, things like that. That's mental illness. In our opinion, PTSD is a condition, and I think that's where a lot of veterans get confused with things when they say, I don't want to be disabled. It's like, well, if you're 100% rated for disability compensation, it doesn't mean that you're 100% disabled. That's a whole other thing. You may be disabled and also have 100% disability compensation rating, but it's when we say the vernacular, I'm 70% disabled. No, you have a disability rating that's at 70% using the strangest math in the world. So, but that's all I have for that question.
Well, and I think the other thing about disability rating is it's not like you wear a sign around your neck that says that, right? I mean, it's you release that information as an individual veteran as you see fit.
That's true.
So this goes into, I think you've partially answered this question, but why do veterans hesitate to file a claim for a service-connected disability?
I'm excited to answer this question because I think about it a lot. I think that when people are struggling with their conditions, usually for years and usually in a way that it affects every aspect of their life, it's very hard for them to admit weakness because it's like giving up. So they don't want to do that. The other thing, I think that can you hear me okay? Yep. All right. Veterans are trained to wait. And we are trained to wait in training because they feel that other people might be in more of a need for it. So, and I hear this all the time. We have a pamphlet about this, but I hear this all the time where people say, well, I don't want to take away from the person that lost both of their legs. And I have to tell them, I have to say, this is a different program than that. This is, there is a program. The person that lost their limbs would, I am very sure, rather have their limbs, but they were medically retired at the next pay grade. They are likely 100% disabled. They also have special compensation for loss. It's a different thing. This is not, you're not taking away from them. Matter of fact, if you file for service-connected disability, in my opinion, you're helping them because you're participating in the process. And then the biggest reason, not the biggest, but one of the big reasons that veterans hesitate to file a claim is that it is freaking complicated. And I'm only saying freaking because this is being recorded, but it is complicated. It's easy to get it wrong. It's easy to miss stuff. I think that people need a VSO to do that. I'm going to talk about picking a VSO in a couple of questions later.
Yeah, I agree with that. I mean, even I have said that is there's people that need VA services more than me. But the fact is, I mean, yes, VA services are finite, but they're not going to be finite in my world, right? I mean, I am not going to break the system by filing a claim.
Can I add one thing to that, Hugo?
Yeah,
Can
sure.
I add one thing? I also think that, and I agree with Dennis, you hear that a lot. And if you look at something like the VA healthcare system, obviously the more people that use the system, the more money it gets overall. So in my area, they just built a new clinic down in Rio Grande in Cape May County. They got that because more and more veterans were reached by the outreach people from the Wilmington VA and decided to join and use the services. So I think that's an important factor. I also do think there's a lot of misinformation out there, and a lot of people talk to their buddy, their neighbor, the neighbor's uncle. This one's a veteran, that one's a veteran, and they decide, well, that guy didn't get anything, so I'm not going to get anything. So I'm just not even going to bother.
Yeah, I agree. I think all of that is true, and what we hope is that through meetings like this, we can get the word out through all these connections to encourage
Correct.
people to make claims and to be part of the VA. So Dennis, you talked about your priorities. What are some of the programs that we as veterans should be aware of that perhaps we're not taking advantage of?
I'll start locally and then I'll go a little bit more globally. But here in Montgomery County, we run a free shuttle, the Veteran Shuttle. We'll take people from their places of residence to a VA medical center and back again. They have to make their appointments between 11 and 2, Monday to Friday. And there's a phone number that I'm going to post in chat for Montgomery County residents to do that. We have transportation deserts in Montgomery County. We have cities like Norristown and Pottstown, and then we have places like Zieglerville. And the funny thing about Pennsylvania, I'm not from Pennsylvania, but it's a colonial state, so to speak. There's a town like every 10 feet. You know what I mean? What stinks is when I talk to some of the older residents, like we have clients that are in their late 90s. We have one that's 100. They start referring to towns that don't exist anymore. And that's a little bit of a hard time as well. But there's a veteran shuttle. The other thing is we serve the entire veteran community, not just veterans. It includes surviving spouses and children until they age out, or if they have some sort of a disability of their own, they can't take care of themselves. I think that the caregiver support program, which has the VA caregiver support program, which just got a new breath of life with the COVID Saves Live Act, is something that more caregivers should be taken care of. That's funny, but they should be looking into it. Our caregivers are selfless people. For a lot of these veterans, they don't take care of themselves for years, and they end up having health problems where they can't take care of their veteran. Another one is veteran health care. We still run into a lot of people that don't take advantage of veteran health care. And we make a lot of referrals for enrollment, and luckily through Fern and Megan and through in the eligibility and enrollment people for Philly and Coatesville, because that's our area. They do a great job of getting people connected. Lastly, dependent indemnity compensation for service-connected death with surviving spouses. If you think that the veterans are not as connected as they should be when it comes to veteran benefits, well, you should just take a look at the surviving spouses, because oftentimes they don't have a clue. They're just not plugged into it. And they don't, every time, and maybe it's obtuse, but every time I talk to someone, to a surviving spouse and their husband passed away, I always want to jump to, how did they die? What conditions did they have? It's kind of ghoulish, but we're looking for, and they look at me like, what is wrong with you? And I'm like, so I'm getting more genteel as time goes on, but I'm looking for bladder cancer, hyperthyroidism, ischemic heart disease, type 2 diabetes, things like that, because we are able to get this dependent indemnity compensation pension for them, which is not the survivor's pension. The survivor's pension is based upon how much money they make. This is in addition to how much money that they make. But they're a priority group for us, veterans of people who died of service-connected illnesses, especially veteran and Gulf War exposures. That's a priority group for us. But and there's a couple of numbers that have to do with healthcare enrollment and things like that. I'm going to put that in the chat just so everybody has it.
When you're talking to a surviving spouse and you ask how their service member died, I think you just need to use your sultry voice, Dennis. That'll kind of
do it. That's true. You're right.
Yeah, just a little hint, you know.
So thank you.
Okay, does anybody, so what is a good way to pick a veteran service officer? So you have this, you're about to choose somebody that's going to guide you through this process. How do you make the decision of who's a good veteran service officer, and how do you make that decision?
I think that if you use the same criteria as picking out a tattoo artist, or a doctor for elective surgery, you're going to be okay. You need to trust the veteran service officer. You need to be able to get in touch with them when you need to be able to get in touch with them. Maybe not instantly. We have about we call it the 48-hour rule. We try to get back to people within 48 hours. Again, all our work is triaged, but they need to get back to you and tell you how your claim is doing, because sometimes the waiting is the worst part. And I think that they need to be a person who ethically maximizes your claim, including secondaries. So they're asking the pertinent questions about hearing about tinnitus, about insomnia from tinnitus, or about PTSD, which is the next question. And they're looking, they're digging, they're trying to figure out, you know, your sinusitis, that you got sinusitis is going to be the next thing, I think, with claims, because the VBA is recognizing that people that spend that time in the desert end up getting recurrent sinusitis. And we have everybody coming back now. Yeah, hopefully everybody coming back from Afghanistan. And that's going to be the new thing. But your VSO needs to dig. Now, and we're lucky here. We're 100% veteran operated in our office. Our intake specialist and our shuttle van drivers, one of which is on the call, we are vested people in the veterans that we serve. I'm lucky enough to have 3 veteran service officer VSOs that are like ninjas. And they take a personal interest in the claim of the person that they're advocating for. If you don't get that feeling with the VSO, well, then it's time to maybe trade up.
So it sounds to me like establishing that relationship and feeling comfortable with the veteran service officer it seems pretty important. Is there like a badge or a secret handshake or a certificate that signifies a veteran service officer?
Yep, there is, and I'm going to put it in the chat right now. And every veteran service officer, and this gets into one of the challenges in 2 questions, but it's the how do you say, every time that you're an accredited veteran service officer, you are issued an Office of General Counsel number. Now relax, that because I know there's a couple of lawyers on the call, they're always lurking. But the thing is that you get an Office of General Counsel number that shows that you're accredited. So if someone says, I'm a veteran service officer and I'll help you out, you could look up their name and location on this link, and it'll get, I'm 47137. But you look it up for a zip code, you look it up by their name, and you'll get it. And if they are claiming to be an accredited veteran service officer, I'm going to talk about that in a minute. There's a way. There's a process for that.
That's good. I didn't even know that. So that's good to know. And I know there are there's been some controversies about people paying to get claims filed. What can you say about that? Is that a challenge that you've come up against?
That's one of the challenges. And I'll answer it now because it's the best way. So we call them pension poachers. And I don't want to call them like the dregs of society, because I don't want to insult the dregs of society. Does that make sense? So they're worse than that. And what they'll do is they'll and it is oppressive. They are cold calling, they're telemarketers, you're getting emails. Just go on Facebook later and put up veteran benefits and hit a search. Next thing you know, you'll be getting ads and phone calls and emails from the algorithm for all of these different organizations. We had one organization promised a person that they would get the maximum rating for aid and attendance within 2 months. As an older gentleman that needed to move into a long-term care facility, and he moved. And then he calls us up and he says, hey, I didn't get my aid and attendance claim. And we said, we are not the federal VA, we're the county VA, what's going on? And he contracted with an organization to put the claim in, and he had to move. He's in transitional housing right now as a homeless vet because he can't afford to stay at that personal care facility. And I know you all have nightmare stories about this. They do things like they say, well, I'll take a percentage. Or they say, well, we'll just take your first check What they
Mhm.
don't tell you is that it's 6 months to a year before you get your claim, if you get it, after your intent to file. That claim is sometimes $10,000 to $20,000. And a lot of times all they're doing, because they're not trained, is they're filling the form out for you and sending it in, usually incorrectly. And I say that because we know it, because we inherit these people after they talk to the pension poachers. The state of Pennsylvania, it is a felony to charge people to apply for veteran benefits. So like I said, we have a process for that. And the process is with the state attorney general's task force. So if you know of anyone that is, and we make those referrals all the time, but if you know of anyone that is in that kind of a situation, you know, and you're in Pennsylvania, let the attorney general's office know. And what's that called? We'll, and they'll take it to task.
Nice. I mean, Dennis, you've covered a broad amount of information. How can DVVC, the organization, and our member organizations support you? How can we work more closely with you?
I feel like I'm getting the hook, so I'm going to talk faster. We had a question about what does PTSD look like, and I just want to hit this if I could, Hugo. I'm going to put an answer in the chat. It's nothing like in the movies. It doesn't have to be flashbacks or nightmares, but it could be. It's a whole host of symptoms that people can have, and I'm putting that list in the chat just to get people to think about it. Other challenges that we faced are veterans that are hard to find, and people who are not veterans. So we run into that quite frequently. Wow. And also veterans who lack a sense of community. We deal with unclaimed remains all the time with veterans, but I'm not going to hit on that because I think Dan Fraley is going to touch on that there. But how can DVVC work more closely? I ask you to be finders and keepers. Find the veterans in need and take care of them where you can. Send us referrals for us to get them help. Please watch and share our monthly video update. Hold on one second here. I got to find it on YouTube. But we do a monthly video update every month. It's about 5 minutes long. Okay, I'll be honest with you. It's never 5 minutes long, but we wish that it was 5 minutes long. And later on, I'm going to put that link up there on the chat. And we just try to use that to keep people informed, especially post-COVID. And we're starting a volunteer program. So I may be trying to hook. Well, I work with a lot of people on this call already, and I may be trying to hook the rest of you in our volunteer. It's an official volunteer program through the Office of Senior Services. And we try to get you help, you know, as a official volunteer with the county. And about the people that we work with on here, my goodness, there's a whole bunch of them. Thank you for your help. We have a lot of partners. We run a multidisciplinary team, and I'm not going to say the name because it's just like Fight Club. And what's the first rule of Fight Club? If you've seen that movie, you don't talk about Fight Club. We run a multidisciplinary team with about 20 agencies, federal, state, local, and nonprofits. And it's our hardest hit veterans in need that we have in the county. And unlike Veteran Crosstalk, like they have in Berks County, or there's another organization I can't remember in Lehigh County, what we're doing in our multidisciplinary team is we're doing case management for these individual veterans in need, so that we can, so that we can help them out and find solutions, cut through red tape, maybe bend the rules a little bit ethically. And but that's just wanted to put that out there that we run this multidisciplinary team. So, and I'm going to put the link up for the YouTube video if you could help us get that out. But
sure. Yeah, we can certainly talk about that. That's awesome. Thanks, Dennis.
Thanks, Hugo.
Okay, so Dan from Bucks County, what do we need to know about Washington Crossing National Cemetery?
Well, before I begin that, I just want to let you know that 2 VIPs I see joined us. Steve Roll from the Vet Center here in Bucks County, and Peter Chung, a Iraq veteran, Chief of Staff for Congressman Brian Fitzpatrick. Just want to let you know
these
these.
For sure. Thanks for pointing those out, Dan.
Okay, sure. So anyway, here in Bucks County and in the Delaware Valley, we have a national treasure for veterans, and that is the Bucks County Washington Crossing National Veterans Cemetery. So it's been here for 10 years. And why I chose to talk about this is that this is something that a lot of people don't realize. Maybe most of your the people on today understand the importance of this, but there are people I know that are in Kensington, the section of Philadelphia where I grew up, Tacony, where I spent my teenage years, that don't know that they can be buried in the National Cemetery in Washington's Crossing. It's free for all veterans and their spouses and a dependent child. It covers all the Delaware Valley, Chester County, Delco, Philadelphia, and South Jersey. So right now we have close to 20,000 veterans buried there. It was a 5-year battle to bring it to Bucks County. Governor Rendell in his first term wanted to see it out in the Pennhurst section of Chester County. They didn't have enough acreage out there. We know that they had 23 buildings like the Byberry buildings that were closed down in the 1950s that were all deteriorated. It would have cost $35 million to prepare that site. Here in Bucks County, we know that General Washington and his troops probably bivouacked there a couple miles from the Delaware River before they went to the Battle of Trenton on Christmas Eve. So we have a historic significance, and I'm having a voice issue, just like Dennis. Believe it or not, of all things, this Marine is allergic to dust mites. So I can't beat them. They give me an allergy and deepen the voice. But anyway, let me continue. So as I said, it's free. There's no pre-registration, just like people, cemetery. It's one of the smallest cemeteries out of 141 national cemeteries in this country. It's 211 acres of pristine, it was pristine open space. What you see up there now is 30 acres that they carved out. Every 25 years or so, they'll carve out another 25 or 30 acres until they reach 125 years. So you don't have to pre-register. A lot of veterans do. There's 3 ways, and one I'm saying it's free. Once you get inside the gate, it's absolutely free. In Pennsylvania, you need a concrete burial vault for casket burials. A funeral director will charge the family $2,000, $2,500 for a concrete burial vault. They're free. The headstone up there, 3.5-foot high white marble headstone, is free. The inscription on the headstone is free. Opening and closing the graves are free. They have what they call combo buriums up there. Above ground cremated remains. They have below ground cremated remains with the headstone. And also they have the casket burial section. And what I tell people is your loved one is never left alone up there. 2 weeks before Christmas, you've probably all heard of wreaths across America. Every veteran's grave gets a wreath on it. There's about 3,000, 4,000 people up there putting a wreath on their loved one's grave. I'm always up there because we transport people, because you can't park up there. There's so many people, but there's a couple churches in the area that we transport people in school buses up to the cemetery. But it's really a warm feeling when you see young children up there with their parents. I know when I was growing up, I wouldn't walk into a cemetery. They were kind of scary back in the day. But the National Cemetery is a place of dignity and honor. All veterans are buried with full military honors. The active duty military is up there. They fold the flag for the widow. They present it to the next of kin or the widow. They all get a 21-gun salute. They play taps for every veteran. There's a group up there called the Guardians. We had something to do with that because the 5-year battle that I talked about, the homeowners up there didn't want it, to be honest, and they were fighting it for 5 years also. And so what happened, we needed people, veterans, to help protect the National Cemetery from all the lawsuits that were pending. So we created an organization called the Guardians. But they're up there today. For the last 10 years, they haven't missed one funeral. And they're mostly Vietnam veterans up there doing the 21 gun salute. And so you got to give those guys kudos for what they do. And they're all volunteers. And they're up there every day, winter, summer, spring, and fall. So I just want everybody to know that. I know I've heard veterans in the Philadelphia area that I know say, well, hold it. I thought that National Cemetery was for those people up there in the suburbs. No, it's for everybody. South Philadelphia, West Philadelphia, North Philadelphia, Delco, anybody. And we have to get the word out. This forum today put on by DVVC is just a great forum because I know there are a lot of people out there that will help get the word out. And because right now, it's important that we all are disciples for this very important cemetery and the things that we do, not only for claims and that we work on our VSOs and our offices, but everything that we do as county directors, being an advocate for our county, trying to bring everything that we can into our county. And sometimes you have to do battle. We did battle here in Bucks County because the governor wanted the National Cemetery in Chester County, but that's an example. But we have to, as advocates for our county, as directors, not only do claims and pensions, and I know in Bucks County we do that well. We have probably one of the best VSOs in the state of Pennsylvania. She's been doing it for 20 years, Betty Carleo. And so when Dennis was talking about our Hugo, you said, how do you find the VSO? You find them because of the reputation, and Dennis will support that. If you have a good reputation, they will come. They will come. They will find you. And because if you help somebody and they get 50, 70, 100%, whatever they get, they're going to tell their friends. Just like was said earlier, you can get a bad reputation, and if you do, the veterans won't come. And then you'll figure out why they don't come, and then maybe it's time to get a new VSO. But the most important thing I think a county director can do is make sure that you have good VSOs. That's the infrastructure of our county and every county, to make sure that we can do claims and get the veteran what they're entitled to. And with that, I'll pass it on.
Well, Dan, that was, I have to tell you that I didn't know all of that information about Washington Crossing National Cemetery. Of course, I knew it exists, but everything, pretty much everything you just said, I didn't know that stuff. So this is great. And I also want to point out that the passion that all of us, that all of you directors have to help our veterans and all our attendees that are participating. I just kind of got a flood of warm feelings just listening to you, Dan, about describing this and the resources that are out there for veterans, and the fact that we're so passionate about it. So thank you for that. The other thing that I have for you, Dan, is what are some of the concerns with homeless veterans? So Bucks County, I think a lot of people would say, well, Bucks County has homeless veterans, and the fact is we do. What are those issues that you face or that the county faces that we need to be aware of?
So, to begin with, Bucks County is a pretty affluent county. We have pockets of affluence, and we have pockets with blue collar and so forth. So what I see is, and I've been to a lot of meetings over the years with encounters and people that aren't on the front lines, and I hear the word over and over again that we've ended homelessness, and I don't see that happening. I know that former mayor of Philadelphia and one of our former directors at the VA hospital was in a press conference and said we ended homelessness. No, we didn't. It will always be with us. In the suburbs here in Bucks County, we find our veterans living in the woods, or they'll live in their cars in the shopping center with all the belongings. And why? There are programs, and there are good programs. The VA system, first of all, we're lucky in our area. We have the Michael J. Crescenz VA Medical Center which is a great facility for such a large city in this country. So we have the support of them and their homeless programs, and also Coatesville. And when you look at the services, it's like you have to find the services. And we as county directors are quarterbacks. We don't provide a specific service. Here in our office in Bucks County, over the years, there are a lot of generous people that want to help down and out veterans and homeless veterans. So we were offered money, and I said, we can't take any money from your organization, whether it was a church or an over 55 group. But over the last 5 years, we've inherited $16,000. And what we did is ask them to give us those money in gift cards. And so $50 increments, $25 increments to Walmart and supermarkets. And what we've done, what we did over the 5-6 years that we've had them, right now I'm pretty low on them. But what we did is, without making homeless people or about to be homeless people or low-income people jump through hoops and fill out forms, we did the honor system. We were given $50 gift cards to supermarkets to people that were down and out or being evicted, and all those people that needed that help. So we gave out $16,000 in $50, $100 increments so they can buy gas. Iraq veteran buying diapers for his child. It doesn't help the problem, but it helps for a short period of time. And so all those things that we see in Bucks County, when you look at the offerings from Philadelphia, and I'm dealing with the homeless outreach people in Philadelphia, and Hank Salvatore and people like that, you find out that the programs are available, but our veterans don't want to go to the per diem housing in Philadelphia. There's per diem housing that will take our veterans who are living in the woods and living on the streets to go into a housing unit in Philadelphia, an apartment unit in Philadelphia, per diem, or a safe haven that they also offer, where they can get out of the cold or get out of the rain. They won't go. We in Bucks County, our veterans don't want to leave the county. So then what do? We rely on SSVF programs. So there was a moratorium, national moratorium on evictions, and that's going to be lifted soon. And so we're going to get hit with a flood of evictions. So our role is really just to be the quarterback. We have programs in Bucks County. We have the housing unit programs and different things that we can help veterans with, but there's always income limits. And so we just opened up a new apartment complex, a private endeavor here in Bucks County and Ben Salem for low-income veterans over 62. But there's only 22 units, so we can use a lot more. So we get calls, just like I know Dennis gets calls. We're looking for housing. We're looking for low-income housing. I'm a veteran. Well, the VA doesn't supply low-income housing. They're not in that line of business. So it's always a struggle when we get somebody, and they always call Friday afternoon around 3 o'clock, 4 o'clock. I'm homeless. I'm being evicted. And so I've always advocated that we have apartment units or motel units that are prepaid. So people like myself and Dennis can say, all right, just go to this motel, get off the street, and now we'll start working. Because another buzzword that really bothers me that I hear the bean counters talk about, and that's rapid rehousing. Rapid rehousing. There ain't no such thing as rapid rehousing. You can't get veterans off the street the day they call, the week they call. Now, the Veterans Multi-Service Center, they do a great job. I've seen them put veterans up. But then I had veterans call me and say, well, I'm working with the Multi-Service Center, and I got to be out of my motel unit in 3 days. Well, there are programs here in Bucks County like FISH. It's part of the Catholic Archdiocese, where they'll put a veteran up for a couple of days. It's run by volunteers. Now they're out of Doylestown and a couple other locations in Bucks County. But these are good people trying to help people get off the street, but they don't have enough funding to keep it going for a while. So all this money that some of these counties have and some of the states have, I think they should set aside funding so that we that come in contact with somebody who's going to be homeless or homeless right now, what are we going to do with them? We have to get them off the street. And we have to get them off the street for at least 3 to 4 weeks before SSVF program and programs like that kick in, where all right, we can get them a voucher, a HUD bash voucher and things like that. But those programs take weeks to get somebody into an apartment. And so there's no filler in between where we can get somebody off the street and right into a hotel or a motel or an apartment. So that's one of the struggles that we have. So, I mean, we all put our own thinking cap and say, hey, yeah, let's do this. Let's get this done.
Right.
And there's no reason why somebody should be out on a cold winter night. And I've seen it. I've been on the pit count up here in Bucks County. We're walking through the woods, finding homeless people living in tents. And it's a shame. It's a shame. Then we go back to our Steely Posturepedic and our warm homes, and they're out there living in a tent. And you get guys and ladies. I've seen the last 2 years ago in 19, I went on a pit count where we were trying to find homeless people in the woods. And a 45-year-old girl, she didn't even want to go into the Red Cross shelter here in Bucks County. Now, a male veteran can't get into the Red Cross shelter because it's not large enough.
Wow. Well, Dan, that was great information. And if anybody's been tracking the chat, Mo Gillen pointed out something. So there's the Department of Veterans Affairs that we often call the VA, but then the VA is broken down into the Veteran Health Administration, the Veteran Benefits Administration, and the National Cemetery Administration. So just Mo, good call out on words mean things and how we're broken down. And Dan, thank you again for that really awesome explanation of Washington National Cemetery. Dennis, I see you raising your hand. Just if you would hold on for a second. I also want to recognize Susan Price, who's the Director of Veteran Services in Chester County. So Susan, if you feel like turning on your camera, we'd love for you to be a part of this conversation. And while you're prepping, Dennis, what comment did you have?
The first comment is that everything that I know about veteran claims, Susan could fit underneath the white part of her fingernail. She's a genius. No one knows more than her. Well, maybe a couple of people, but certainly not me. And I go to her all the time for advice. But with the homelessness piece and people getting evicted, we don't call it this program. We did, and then we stopped calling it because we were too busy to name it. But it's soft landings for veterans. And what we do is we use legal aid of Southeast Pennsylvania, which you can't use elsewhere, but pro bono legal services to make sure that renters have due process before they're evicted. What does that mean? That means that they provide delay tactics so that they could hopefully stay in their home, due process or landlord mediation, just like the SSVF providers do, but it's different when you have a lawyer doing it. And the lawyers will maybe delay that eviction enough so that an SSVF provider or another provider, because depending on the discharge, it's not necessarily an SSVF provider, but so that they could delay that eviction and get them rehoused without having to go to a shelter or without having them living in their car. But we find that is the most effective tool in that process. But just wanted to add that to that, and I'm going to turn my camera off. Thank you.
Cool, thank you. Susan, this is your opportunity to kind of address any of those questions from a Chester County perspective, if you'd like to. Susan, are you with us? All right, well, so I guess Susan's having technical difficulties. So from a high level, one of the questions, so this ends kind of the formal portion. Now we can open it up for questions. So any attendees, if you have questions, please put them in the chat. I do have a question from I guess this is probably Alicia and I'm not sure who from Pennsylvania. So there's DMAVA in New Jersey and there's DMVA in Pennsylvania. Alicia, can you kind of talk the process or how the system is set up in New Jersey? And then
Sure.
I'm not sure who the smartest person in Pennsylvania is. Maybe based on Alicia's response, you can kind of say.
Right, because
here's
it
how
is very different between New Jersey and Pennsylvania, how the departments work. The main difference is in New Jersey, DMAVA has VSOs. So Department of Military and Veterans Affairs, we are everything from, you know, the National Guard technically falls under that, to the cemetery, to the memorial homes, to there are 2 homeless programs for veterans who are homeless that are run Vets Haven North, Vets Haven South, the state medal program. I mean, everything you can think of is probably the same as in Pennsylvania, but New Jersey actually has accredited VSOs in each county. So we work along with the county VSOs. We all do the same thing. We all want to get the benefits for veterans and get them the services that they need. But that's the main difference, I believe, between Pennsylvania and New Jersey. We have those VSOs in each county, along with each county having a VSO or multiple VSOs.
Okay, so to make sure I understand, so there's a state level VSO in each county along with a county VSO in each county.
Correct.
Is that the distinction?
Correct.
Okay,
Correct.
thanks for that.
And I did just want to say one quick thing
yeah.
on the homeless. I did put in the chat box. There is I work, my main office is in Atlantic City. Unfortunately, a tremendous amount of homeless veterans and non-veterans in Atlantic City. But there is a stand down that is a coordination with many different services and many different entities. The DAV is involved, the Legion. And that is happening in Atlantic City on September 8th. I put the information there. That is anything from getting information to veterans, but there's also food and clothing that's handed out. The VA healthcare is there. It's a good place, and anybody from all over, anywhere. They don't ask for, you know, your license when you come in. So it's a good option for a lot of people to get a lot of information all in one place.
And
Great.
Hugo, could I just also comment on something that
Yep.
Alicia said about county VSOs and also state VSOs? We do work very closely together. And as a matter of fact, the state VSOs or the state itself, the department, the MAVA, holds quarterly training sessions to go ahead and make sure that we stay accredited, or CEUs, as they call them, continuing educational units, to go ahead and make sure that we go ahead and continue to maintain our educational requirements. So we work very, very closely with them also in that. So there's a lot of coordination between the MAVA VSOs and the county VSOs too.
Great. Okay, so we got some questions coming in, so I want to clear this up real quick. So Dennis or Dan, can you? I mean, maybe it's simply a yes, Alicia's completely correct, or is there any subtlety to how Pennsylvania does things as opposed to New Jersey?
You know, Erica Moore might still be on the call, and she is our outreach specialist for the area. And yep, yeah, Erica's on the call. Maybe she could answer that because she's a state person.
Erica, feel free to chime in. Erica and I have been exchanging emails over a different topic for the last week, so Erica and I know each other.
Hi, Hugo. I was actually on a call. So what was the question?
So Alicia explained that in the basic question was, what's the difference between how Pennsylvania runs things and how New Jersey does? Alicia, if I have this correctly, says things are very similar, except that in New Jersey, there's a state VSO and a county VSO in every county. And what I wanted to clear up is, from the Pennsylvania perspective, is that the major difference between New Jersey and Pennsylvania in terms of?
Yeah, so we do not have a state VSO in every county. However, the VSOs in each county are accredited through the state.
Yep.
But they also can hold accreditation through like the American Legions, the VFWs, those sorts of things.
Yep.
But we have VSOs in our state office.
Yep.
We have them in Philadelphia and in Pittsburgh, but the county VSOs, there is not a state VSO in each one of those counties.
Got it. Okay, so it sounds to me like we have a common understanding of the difference. So that's great. So Stephanie Booker, you wanted to, I think you had a question about homeless or a comment. Do you want to chime in real quick?
Good afternoon. Is it still, no, it's still morning. Hi, everyone. Yes, I'm just so happy that I was able to be on this event, Zoom meeting, and thank you for hosting, Hugo. But a lot of the things that you guys were saying regarding the homeless population and the reluctancy to go into some of those places, our organization called Ahari, we hit the ground running weekly, servicing these transitional houses in Kensington area and the height of the opioid pandemic. So I hear the needs of the veterans. I see the suicides that's happened from the beginning of the pandemic to now. And it bothers me because I'm not gonna cry, but my husband, he went through a lot with the VA. And I'm hearing y'all talking about how good the VA is. It was not good to us, not at all. And I see these veterans out here, they're struggling and they have all this money out here, but you have them walking around aimlessly. And there's little people like us, they have a trust issue with the veterans population and we cannot get help.
Well, Stephanie, so I completely understand your perspective and I appreciate it. I one of the reasons that we're doing this is to build up that trust in the VA.
Yes.
and to get that education out there. So
Yes.
what I would ask you to do is reach out to your county veteran service officer and figure out how the VA can do right by you and how the veteran community can support you. There was a question that popped in. Steve asked, and this is really for anybody who wants to take this. The question is, how often should a 10% service-connected vet meet with one of you? So the question in my mind is, should there be a periodic meeting if somebody has a disability rating? Is there a need for that? Or what are your perspectives on that?
I think it depends. I just actually responded to Steve. In my mind, it depends. Anytime, to me, the veteran has a change in health or a change in circumstances, whether they're 10%, 0%, 70%, they should reach out to a VSO and just see if there are other services that they might be entitled to. But everybody should look at their claim and be aware of any changes that might be out there. You can look at Vietnam vets. They just added those couple of issues to the presumptive eligibility. If you don't look at your claim every once in a while, you may not know that there are other things that you could put on. You may have secondary conditions that popped up since you did your original claim. So I think everybody should look at their claim, no matter the rating, every once in a while.
Well, and Alicia, I think what you're bringing up is how I think this becomes a much broader question. So let's ask this from the 30,000 foot level. So Steve talked about, hey, I'm 10%, but maybe things change with the VA. There are other. So Steve, I don't know how old you are, but maybe it's Agent Orange or it's burn pits. So as things change within the VA, how do you as veteran service officers and how do we as the veteran community get that word out that, hey, these things are changing? I mean, certainly our perspective is having meetings like this. Is there more we can do to support that?
One of the things that I'm doing, Hugo, is I've been making arrangements with various veteran service organizations rather than veteran service officers, but veteran service organizations such as your American Legions and your VFWs and also the Marine Corps Leagues and so on, Vietnam Veterans of America. I go out and I attend some of their meetings and I go ahead and tell them some of the things that we do on their behalf in the county. So they get the word out. I get the word out to them, and then also we have an awful lot. We do outreach. We also try to go ahead and we have, for instance, a veteran. We just recently had a veteran resource fair where we go ahead and get information out to the veteran community. So outreach is, trying to get the information out there to go ahead and make them aware. I always think about the balls in the court. So therefore, if the ball is in the VA court, well, then whatever decision comes out of the VA. But I wouldn't necessarily go ahead and approach the VA to go ahead and check or to go ahead and query about my rating, unless something drastically changed in your situation, like you got hit the lottery, you got money now, so therefore you don't need any money from the VA. So, there's certain things you might want to go ahead and, your life circumstances change and you approach the VA, but that's my opinion.
Dan, do you have a comment? So,
Yeah.
so go ahead.
Yeah, so if you're rated 10%, let's hypothetically say 10% would be a hearing loss claim. And the VA rated you 5 years ago at 10% for hearing loss. Now you find that your hearing's getting worse. Well, that's the reason to come and see a VSO for an upgrade. If you are a Vietnam veteran, as has been discussed, and you have a service-connected disability of like say prostate cancer. Well, the VA rates somebody 100% for prostate cancer. And then what happens when the cancer is adjudicated, meaning they make a decision to remove the prostate or they have radiation or whatever the treatment it is, then VA will then reduce that back to 40%. Well, sometimes the cancer comes back. The veteran may not know or be in a condition mentally to file for an upgrade. But so those are the kind of things where the veteran comes back and files for an upgrade, or his wife would call. But the 10% hearing loss or something like that, where the issue gets worse, whatever the VA rated for you is the plateau at 10%. So from there on, if that condition, whether it's a knee injury, gets worse, you get arthritis in the knee after 10 years, the knee starts aching you come back and then you get it reevaluated and then you can file for an upgrade. And typically to be able to adjudicate the claim in favor of the veteran.
Gotcha. Thank you for that, Dan. Norm, you texted me earlier whether you could say a couple things. Go ahead, Norm.
Yes, just a couple points. For the VSOs and other people organizations, one of the things that I did want to bring up, I retired as a Veterans Healthcare Navigator from New Jersey Hospital Association. The ability of everybody here, and I commend all of you because I've met many of you, is the connecting the dots through the different agencies, making things available. A lot of people don't understand the character of discharge does not always negate the ability for benefits. So a lot of times that has to be pushed a little bit. The interaction of social services departments with the veterans departments or the VSOs for services that may be available and may not be available because of character of discharge. And I'll use an example of years ago, and a lot of people have not gone back and got their paper changed. People got bad paper for being gay. Now it's okay. So it's just a point that, there are things available to them. They don't know that. The national service officers of the veteran service organizations, a lot of people are not aware that they need to be accredited as well as the VSOs to handle claims, to be handled correctly. One of the things that I also saw recently was one of my best friends. He was my best man when I got married. He's 100%. He passed last year. The doctor put COVID. He did not put the issues that he was disabled for. Therefore, his wife gets nothing. We have attempted to get that resolved and still have not been able to. They won't change the death certificate. They just put COVID on there. That's it. So if you know of that, you may be able to help with that in some instances. Indigent veteran burial in New Jersey has been an issue. The MAVA has done a great job of trying to resolve that. I can't say enough about the people at the top that have worked to get that program in place to help straighten it out. The problem is we need to let social services and other departments know that that's available. All right. Someone asked a question about legal issues. Two of the things that I would recommend, they have helped me greatly, and that is Volunteer Lawyers for Justice, and the other one is Rutgers Law in Camden. They have legal services available to help veterans, so that's good. The other point is WRIST, War-Related Injury and Illness Study Center. There's only 3 in the country, and we have 1 in New Jersey. People need to get connected with that. whether they're Vietnam or the burn pits or anything else. My understanding is that the VA is trying to get ahead of the curve so they don't get screwed up like they do with Agent Orange. So these study centers, and they have some great people working there and are very active. COVID has stopped their outreach to a degree, but all you got to do is call and get somebody in there. And I'll give you an example. I met a gentleman in a store. I recommended that he go there, and he was having a lot of problems. They immediately put him in the hospital for a few days. I ran into him again, and I didn't even know this guy. He come over and grabbed me and hugged me and couldn't thank me enough for wrist. So hopefully that helped him, and you can guide other people to that.
Norm, can you put those? Can you put those? Can you just type those into the chat so people can refer to them and they can get that list? I hate to cut you off, but we have a couple questions.
Yeah, no problem.
So one of the questions that popped up in chat is Gold Star families, and I know one of you mentioned working with family members. So can any of you address specifically dealing with Gold Star family members?
I actually think that probably is a category of family members that doesn't get as much attention as it should. It's the same type thing. It's getting information out there, getting people to understand that there are services for Gold Star families. I know on the DMAVA website, there is information about services that might be out there, and it basically says contact a VSO.
Right. Well, so for DVVC, I think one thing that we need to consider on our website is having Gold Star families as a category, because I know, so just for me, Travis Manion Foundation deals specifically with Gold Star family members, and we can refer people to services. So that's a good heads up, just for the community in general. One question popped up about female veterans, and specifically in Pennsylvania, but I'll open it to both New Jersey and PA. Do any of you have you had experience with dealing specifically with female veterans, and what are the specific challenges there, and how have you dealt with those? And is there a way that DVVC or our member organizations can help?
There are challenges. I deal with a lot of female veterans. I think sometimes, cliche or not, it's easier for a female veteran for certain things to deal with another female. There certainly is a hesitation. There's a hesitation across the board with veterans to reach out and ask for help. But with a lot of female veterans, depending on what type of help they are looking for, it can be very difficult to admit that something happened, and admit that something happened that you never told anybody about until today.
Right.
So the VA healthcare has a system for female veterans. I think it's like any other veteran, or maybe more so just starting slowly and listening. And maybe we start with, your hearing got damaged while you were in Afghanistan. We're not going to talk about some of the other issues until we can get you to trust and move forward.
Right. So one of the things that pops into my mind immediately, and we're getting close on time, so we have time for one more question, is perhaps both in New Jersey and in Pennsylvania, there can be a specific list of female veteran service officers that can be a resource for female veterans that perhaps feel most comfortable talking to a female veteran service officer. Just an idea. One of the questions sorry, go ahead, Ted.
I was just going to say, I guess up until COVID, we used to go ahead and see people here in the office, and then we started doing telephone appointments. So, but I would say that before COVID, we used to go ahead and get a number of female veterans who would come in to go ahead and talk about access to services, especially healthcare services, and also if they were sexually abused or something like that, as far as maybe something that happened in the military, to go ahead and get a compensation for whatever it may be, a benefit from the VA. I would say during COVID, we haven't really been approached too much as far as female veterans here in Camden County anyhow, but it's obviously one area to be aware of, to go ahead and
Yep.
be sensitive to. And yeah, you're right, maybe about a female VSO. And at this office, there's 3 VSOs, they're all male, but we are planning on having a female credited very, very shortly. So
That's awesome. Good. And we have time for about one more question. So there was suicide prevention. Are any of your offices actively working on suicide prevention within the veteran community? I mean, we all know it's an issue, but is there anything that your offices are doing, or how we can support you actively on suicide prevention? And I think we probably have room for one or two of the VSOs to comment on that. Anyone?
This is Dennis. We wish we were doing a lot more. We deal with it just as much as everyone else does. You know, that the national average for veterans is higher than the rest of the population. I think that the definition of success when you're working with someone at risk of suicide is whether or not they're connected to services. That's it. Everything else is out of your control. If they're determined, they're determined. And that's how it is. So I'm just putting that out there because it could be very frustrating. It could be very disappointing.
Yeah.
The other thing is that we refer them to the Veterans Crisis Line, I'm sure as you all do. But if they don't trust the VA, they don't trust the government, and they're paranoid, we have a mobile crisis unit that is, hold on, is Sarah on the call? I know we have someone from Mobile Crisis Unit on the call for Montgomery County. They work for Access Services, and I can't find it right now. But when we do have people that fall into this category, what we find is a lot of times it's a cry for help, and we try to get them some kind of help. A lot of veterans lack a sense of community, and there are other things that are not. I mean, and the VA, we have Coatesville in our area. They're fantastic. They're the experts. It's like a college campus down there. It's wonderful. Right. But the Cohen Clinic will help people with different discharges as well, and Shamrock Reigns will help people up in Bucks County with the horses, and it's getting them connected to services, not necessarily group therapy for suicide or medication, just something. Just join a VFW. Most of the VFWs in our area, because they have so many social members, the veterans don't pay dues.
Right.
I said, I need you to join a VFW and go hang out with other people and other veterans and get a sense of community. I'm not saying it's a panacea or a cure-all, but that we get them connected to somebody.
So I think my closing comment will be, and Dennis, I think you kind of hit the nail on the head at the end of that, is personal connections of being there for other people. Obviously, some of us get involved with a ton of veterans, but the fact is, we can have impact on people one at a time through personal connections, personal relationships. Johnson & Johnson has a campaign of #BeThere. Whether that's for a veteran that just needs to feel part of a community, whether it's the other end of the spectrum of they have suicidal ideations, but I think our responsibility is to have these personal connections with veterans and steer them in the right direction, have awareness that these VSOs, Veteran Service Officer exist, and also that veteran service organizations exist to deal with a lot of these issues. So Alicia, thank you very much. Ted, thank you very much for being a part of this. Dennis, thank you very much. Dan, thank you very much. And Susan, I wish we could have gotten you a chance to talk, but thank you for attending.
What's the name of that thing, Hugo? Being There by Johnson?
Be there. Just #BeThere.
Okay.
It's just have a connection with somebody.
Okay, I'm interested in that. If you could send something in chat, or I don't know what the hell a hashtag is. It's the number symbol. The idea is perhaps the best way to suicide prevention is just being there for somebody, to listen to them, to connect them with resources. Yes, thank you, Fern. So thank you everybody for attending. If you have any last comments, you can put them in the chat, but we're a little bit over time. So thank you again. Have a great rest of the summer. Don't forget, elections are coming up. We also have our next meeting in October, which will be awesome because we're going to talk about kind of alternative therapies. And again, right now,
that is going to be virtual. And please check out dvvc.org. It's still, I mean, it's up and running. We're still working on perfecting it. And if you have any questions, please don't hesitate to write to dvvcinfo@gmail.com. Thank you very, very much. And so I would ask if you don't have to hang out, drop off, because the executive committee is going to have a quick discussion after this. So thank you very much, everybody. Have a great weekend.